Well, all the women out there who are experiencing premenstrual syndrome, you might be feeling a little anxious, sometimes a little bit of depression, but mood swings, right? So that's kind of what happens, and chronic stress. And I don't know, how many of them are using conventional medication, but we are talking about naturopathic doctor. We are talking to a naturopathic doctor how to help you with overcoming all the symptoms of premenstrual syndrome. So I have Dr. Kinney. Well, Dr. Kinney is right here. Dr. Erin Kinney.
Hi.
Hi, how are you?
Good. Thank you for having me.
Absolutely.
Oh, I'm just
So this is actually a very interesting topic. Like a lot of women go through premenstrual syndrome, and we have Dr. Kinney, who is an expert in naturopathic doctor. She's president of the Maryland Naturopathic Doctor Association. So she's done a lot of amazing work. I've seen your work on so much awareness and so much advocacy that you're doing to focus on women issues. So tell us a little bit, why did you switch to the women issue as opposed to doing something else?
Well, mostly because naturopathic medicine helped me so much with helping balance my cycles, and I struggled with adrenal fatigue for a long time, and it started to adrenal fatigue can start to mess with your thyroid balance. It can mess with your menstrual hormones. It can mess with a lot of different things. But and I treated a lot of women, and particularly in the past year, I've seen a lot of women with worsening of their PMS, or they're skipping periods, or they're in that perimenopause phase, and their hormones just are totally imbalanced. And I think I ended up specializing in it because a lot of Western medicine docs they just are like, oh, here's an antidepressant, here's the birth control pill, you're fine, you're just a woman, it's normal. And so many women think, wait, I don't want to take the birth control pill, it makes me crazy, or I don't want to take an antidepressant, I want to get things balanced. But the tricky thing is, it's not just, I think it's not treating hormone imbalance. You're not just looking at labs, right? That's a piece of the picture, but you have to really have the time to listen. So when I sit down and talk to my patients, we spend a lot of time talking about, okay, let's go back and give me the last 6 months history of your period. So what, when was your last period? What about the one before that? How long are your cycles? How long do you bleed? What's your PMS? So you can really get a lot of really good clinical information just from talking to someone. And that's usually where I'm figuring out the little nuances of how do we get things back into balance. I always like to say that your hormones as a woman, there's so many hormones that we have going on, right? And there's all these feedback, your brain is producing hormones to tell your ovaries to produce things. And then there's feedback loops that go back to the brain. When it's working properly, it's like a perfectly orchestrated ballet. All of the little hormones are doing their particular roles, and they're wearing their particular costume. And if one hormone, let's take, for example, if you're a nursing mom, maybe you've been nursing and your baby's a year old and you're still nursing. If prolactin is even slightly elevated, which it has to be when you're nursing, that can start to mess with your estrogen production. It can mess with your follicle stimulating hormone. It can mess with everything. So it's like prolactin is the one dancer in the ballet that's not doing their role properly, and it's messing up the entire rest of the choreography. So then we have to figure out, how can we get prolactin back into their role? And so there's a lot of little nuanced things that we can do to get things back into balance. I know I kind of threw a lot of information out there, but so that's kind of a long story short of how I ended up getting into this, because there was a need for it. And I love talking about hormones. I love trying to be a detective and figure out, okay, well, what's going on here with this, and talk to me about that symptom. And I end up a lot of times finding a lot of my women with menstrual hormone imbalances, they also have a thyroid issue, or they also have adrenal fatigue. And so we have to balance those pieces too. Because stress, if your adrenals aren't working properly and you're not responding to stress, that can affect how much progesterone you're making or how much estrogen you're making, which can then affect your ovulation, which then can affect the whole cycle. If your thyroid isn't working properly, it can mess with your hormone balance as well. So we have to make sure that all hormones are working again in that perfectly orchestrated ballet. And it's not just the typical estrogen, progesterone, luteinizing hormone, FSH. We got to look at all. And then blood sugar too is another big one. If your blood sugar is not balanced, if you're someone who's struggling with type 2 diabetes, or your blood sugar dips, that can affect your stress hormones, which can then affect so there's a lot of different things to look at.
That's very complicated. Our bodies are so complicated as women. And then, and I'm not a doctor, and I was reading up, all these things that women will start feeling either anxiety, depression, like you said, and take antidepressant, or mood swings, chronic fatigue. I mean, this is really bad. And someone is asking, what are we talking about? We are talking about premenstrual syndrome here, and what happens, and how can naturopathic doctors or natural medicine can help. That's what we are talking about. So
yeah. Well, so, and I will say that one of the most, if we're specifically talking about PMS.
Yes.
The most common cause, so in PMS would be any sort of changes in symptoms the week before your period. So maybe you get headaches, maybe you get really fatigued, you might get acne breakouts, you might get really irritable, or some people get really depressed, or basically you have some sort of major intense change in your regular bodily functions the week before your period. And for some people, things get better when they start their period. So they're really irritable, but then as soon as they bleed, they feel better. Other people, they get those symptoms while they're bleeding, but sometimes, so it's around that time when you start your period, things are a little bit off. The most common cause for that is when your progesterone levels, so in the second half of your cycle, progesterone is the dominant hormone. It's supposed to peak at around day 21, and then it drops off, and that's when the bleed happens. But if progesterone is not high enough, and so let's say progesterone should be up here, but let's say it's here, and your estrogen is higher, that tends to cause what we call an estrogen dominant type picture, which can cause bloating, it can cause breast tenderness, it can cause anxiety, it can cause difficulty sleeping, it can cause cravings, cramping. Most of the typical PMS symptoms that we see are from a slight estrogen dominance, and sometimes that can be because you're exposed to too much estrogen. So if we're looking at how diet affects all of this, if you're eating a lot of hormone or a lot of meats that aren't organic or that are high in hormone levels, if you don't have chicken, they pump a ton of estrogen into chicken if you're not eating hormone-free chicken. So that elevated estrogen can then get into your system and can start to affect that second half of your cycle. So it's either your estrogen levels are too high because of things probably coming into the body, or estrogen levels are normal, but your progesterone levels are low. And the low progesterone levels tends to happen when the body's under a lot of stress. So what happens is when the body's under stress, the body wants to produce cortisol, because cortisol is the stress hormone. And cortisol, if there's not enough cortisol for the body to use when it's stressed, the body will steal from progesterone, because progesterone can easily be converted into cortisol. So if you're super stressed, particularly if you're stressed that week before your period, so if you're feeling anxious and that's creating a lot of stress, the body will go, "Ooh, I don't have enough cortisol. I'm going to steal from that progesterone over there, and I'm going to convert it into cortisol." So then your progesterone levels lower, which can then cause this progesterone estrogen imbalance, which then gives you PMS. So there's a lot of other things that it's kind of like your body's robbing Peter to pay Paul in that. But so that's kind of how adrenal fatigue can start to affect your PMS type symptoms. So the work that I'm doing is figuring out what's causing the PMS. Is it too much estrogen because your diet's not great, or is your progesterone too low? And then I have a lot of herbal treatments and diet changes and lifestyle things that we use to get those hormones where the progesterone's back up in the second half and estrogen's back down at a normal phase.
Got it. So the balance of the estrogen and progesterone is very important, so that all the symptoms that you talked about, those are as a result of imbalance, right?
Yes. And this can also happen, it's really important to have your hormones balanced in the first half of your cycle too. So the first half of the cycle tends to be the more estrogen dominant one. So the rise of estrogen is actually what tips off ovulation. So if estrogen is not rising in the first half, or if it's rising too high, that can also cause problems. One of my favorite really simple practices, if you guys that are listening are feeling like your hormones aren't quite balanced, there's a practice called seed cycling. And so you can, in the first half of your cycle, I always confuse this, I have to look it up. You eat the seeds that, brain
I think
is a
the
little...
flax seeds, yeah.
Yeah, so it's flaxseed and pumpkin seeds for the first 2 weeks, and then you do sunflower and sesame seeds for the second 2 weeks. And you do about a teaspoon daily of each. Then you can grind them up and mix them into a smoothie, or you can just eat them. And so in the first half, the flaxseed and the pumpkins are increasing estrogen. And then the second half, the sunflower and the sesame will increase progesterone. So it's a really nice, simple way. And for some people, that works. It's amazing for helping balance things. There's also lots of good fiber in those seeds, so it helps improve digestion. And digestion, your liver and your digestive tract are really important for breaking down hormones. So our body's constantly making hormones to do what it needs to do with the cycle, and then the liver has to break down. So, when the progesterone drops, your liver has to work extra hard to get that down. So, and that's sometimes why some of my patients will tell me that the few days before their period, they get night sweats, or they wake up at 3 a.m. and they don't sleep well and they're anxious. That's usually a sign that their liver isn't functioning properly. So doing some liver support can sometimes help kind of those symptoms and to help balance out hormones as well. So there's a lot of different things that we can do and that we look for. But again, I mostly will take a really thorough history, and through that history with what's going on symptomatically helps me determine what path we're going to go treatment wise.
Okay, so let's just I don't know what the question is. Okay, let's just talk about the common herbs. Like, as a naturopathic doctor, I'm sure you use diet, of course.
Yes,
a big part of it, but supplementing that are some of the herbs. I love to learn a little bit, and I think for the viewers also, just the common herbs that help with PMS.
Yeah. So my two favorite herbs, like simple herbs when I'm trying to balance, is there's an herb called Dong Quai, which it's also called Angelica, and it's an estrogen boosting herb. So I like to have people take that for the first half of their cycle. So, and when we say the first half of the cycle, that's from day 1 when you start bleeding, typically until about day 14. So in that, Dong Quai will help to raise the estrogen level, so you have a good ovulation and your ovulation hormones. And then or did I flip that up? No, excuse me, I flipped that around. Dong Quai is the second half. Sorry, excuse me. I didn't get much sleep last night. So sorry, Dong Quai I like people to take from day 15 to day 28. That is, so scratch what I just said if you're listening. Dong Quai is a more progesterone focused herb. Black cohosh I will have people take for the first half of the cycle, which is a little bit more, that's that is a estrogen boosting herb. Dong Quai is more of a progesterone boosting herb. You can also use Vitex, which is a really good, Vitex helps stimulate the brain to tell the ovaries to make more progesterone. And that's something I'll have a lot of women take like if you just want to take one herb to help balance things, Vitex can do a really good, usually you take about I like to have people start with about 400 milligrams. You can either take it in a capsule or in a tincture. And there's differing research on whether you take it in the morning or the evening. I tend to have people try both because it can help with sleep. It just helps kind of balance things out. So Vitex is really great, and you can take Vitex with black cohosh for the first half, and then you can take Vitex with Dong Quai for the second half. There's lots of other herbs, but those are probably my 3 favorite ones when I'm trying to balance and regulate things. I also like adding in, again, some liver support. So something like a milk thistle or dandelion, things that are going to help speed up the liver detox process herb-wise. Those are, and you can do that in a tea. Dandelion tea can be wonderful for just kind of calming, like helping liver to do a little bit, liver and kidneys to kind of detox a little bit. And milk thistle is phenomenal. I see there's a question about fibroids.
Yes.
So fibroids are 9 times out of 10 are caused by too much estrogen. And so typically when I'm treating fibroids, the first thing we want to do is figure out where is your system getting all the estrogen from. Are you getting excess estrogen, or is your body not able to break down its own estrogen? And when we look at estrogens, there are multiple different types of estrogen. So there's probably 15 different estrogen-like compounds that the body will make, and some of them are harder for the liver to break down than others. And typically in fibroids, there's higher amounts of these more difficult to break down estrogens. So and first of all, my baseline fibroid treatment is we look at diet. There are certain foods that can trigger an upregulated response of estrogen. There are certain foods, if you've got fibroids, the first thing you want to do is make sure you are not consuming any hormones. So if you're eating meat, it's okay to eat meat. You just want to make sure you're eating meat that is hormone free. So do not eat chicken unless it says no hormones added. Do not eat steak. This is just, and when you're buying your own meat, this is easy. When you go out to eat at a restaurant, you don't necessarily know where it's from. So if you're really trying to treat fibroids naturally, I usually recommend, if you're going to eat out, eat vegetarian, because and oftentimes when I have people, oh, you don't eat meat. Okay. So if you're already not eating meat, then we want to look at other sources of estrogen coming in. So any products that you put on your skin, or, you know, deodorant or hair product, if it has fragrance in it, that typically has, or phthalates, there are a lot of toxins that can become estrogen mimicking compounds in the body, and they can make it harder for the liver to break things down. So that's usually where we start, as we look at how to get the liver to break down your estrogen levels. So if you're using microwaves and you're like microwaving, and I don't know if you are, whoever's asking the question, but if you microwave anything in plastic, the estrogen in the plastic is going to get into your food, and then you're going to get estrogen. We get estrogen from a lot of, like, drinking water out of a plastic water bottle, you're going to get excess estrogen. That's
crazy.
Yeah.
It's like remove all the plastic from anything, right?
Yes. Yeah. So plastic, you know, I like to get, you know, I love kombucha. I don't drink kombucha, and I will reuse these glass bottles. I don't like to drink out of plastic. I think plastic causes a lot of problems, and you don't microwave. Well, that's great. You don't microwave. So, and everyone's a little bit different, but so the estrogen is usually the first thing that I look at when we're treating her. Oops, sorry.
Yeah.
There are other pathological or things that can cause fibroids, but that's usually the baseline thing that we look at, is helping the liver to break down. And then the other thing I will just say about fibroids is, because I'm treating a few patients right now, and the body has started to break them down. Typically, you know, your body can break fibroids down, but then for a few months you're going to have heavy periods. They're going to be heavy clots, because that tissue has to come out of the body, right? So it's sometimes my patients will call and they're like, "What's going on? You know, I don't have any pain, but I'm having these crazy periods, and there's all this stuff coming out." But I'm like, that's your body breaking down the fibroid tissue, so that's a good thing. So there's also, and I don't know whoever was just asking the question, if you were on the birth control pill for a long time, or if you're currently on it, that's estrogen. So, and sometimes it can take the liver a long time to detox the estrogen that was built up in your body from being on the birth control pill. So, and birth control pill or NuvaRing or any sort of birth control that's hormonal. So that can also be the IUD, the Mirena IUD, if they're, you know, it's giving your body low dose estrogen. If you take estrogen consistently through a pill or the NuvaRing or whatever, it stops ovulation. So that's what happens with birth control. You're not ovulating. So you still will get a bleed because you stop the estrogen and then the body bleeds. And yes, whatever, Vina, I'm not sure what your name is. You can get, if you go to my Instagram page, you can find my number and call the office. We can do a consult. We can chat about that.
Yeah.
So, yeah, what else were we talking about? Sorry.
No, if you need a consultation, you can DMS us and we'll connect you with Dr. Kinney. That's not an issue. Looks like they need a consultation because all the things that
I'm like, you know, we need to talk because you sound like an interesting case.
Yeah. So all right. So I think we talked about some of the herbs. We talked about seed cycling. Do you want to talk about the type of foods that women should focus on more? And of course, we know what to avoid, like the processed and, you know, the dairy and all that.
Yeah.
But is there a certain, like a protein, carb, or combination?
Well, so that's kind of dependent on, I mostly will look at what people's blood types are. So you know, if you're blood type O, I'm usually saying you want to focus on a protein, low carb, low dairy, protein and veggies. If you're blood type A, I tend to say you're probably better off being more vegetarian. Blood type Bs do more like a Mediterranean diet. So that's kind of varying. I will say that the foods to focus on with PMS, I mean, obviously getting good protein to keep blood sugar stable is very important, but focusing on those cruciferous vegetables is really key, because those are really important for what we call phase 2 conjugation in the liver. And that's the liver detox pathway where the liver breaks down hormones. And so because there's so many PMS issues do have something to do with elevated estrogen, eating a lot. So cruciferous vegetables would include, you know, broccoli, cauliflower, Brussels sprouts, kale, any of those guys in that Brassica or whatever it's called family, they're going to be really beneficial for the liver. So those are usually the foods that I'm recommending my women to eat more of. And like you said, cutting back on processed food is obviously super important, and making sure you're eating organic as well. And I've had a few cases of people with fibroids or with endometriosis or with some kind of more serious menstrual pathologies where we've actually uncovered that they had celiac disease that was never diagnosed. And so once we cut gluten out, you know, it's like the inflammation in their whole system went down and things tended to balance out. So sometimes there are certain foods that can be upregulated inflammation, which can then affect the hormones. And then, but yeah, I think for general basic dietary guidelines, make sure you're getting enough protein and make sure you're eating enough veggies, and organic. Make sure you're buying organic veggies. You don't want to be putting pesticides into your system if there's already an imbalance in hormones.
Okay. Yeah. No. So you have to be a detective as a doctor, you know, understanding, like doing all the different tests and understanding the history, like you talked about earlier, going back 6 months as to what is happening in their, you know, in those, and then trying to figure out an action plan that to help solve that problem. Right?
Yes. Yeah. That's usually when I'm meeting with clients one-on-one or patients one-on-one. You know, I want a very thorough history. You know, like I said, I will talk about periods back 6 months. I also want to know, did you ever take the birth control pill? Did you know, have you been pregnant? Like, did you go through infertility treatment? Did you, you know, all of the kind of hormone history? Yes. And then I typically will run a bunch of lab work to see what's going on. And then we kind of figure out, based off symptoms and labs, like where to go treatment plan wise.
Yeah, no, I think that makes sense. Okay, any more questions before we wrap up? I mean, this is an amazing session. So you've got an actual patient kind of asking a question.
Yeah.
But any more questions before we wrap up? I think this gives enough information to all the viewers, just a framework, you know, that's what our sessions, we want to give people framework as to how naturopathic medicine can be so different than conventional medicine. You know, doctors are spending so much time with you to really understand deeper into what the problems are, the root cause, right? Yeah. As opposed to
and if you guys listening are interested, I have a podcast that's been out since about January, and I have a lot of guests come on the show, but I talk a lot about naturopathic medicine and kind of the difference between naturopathic medicine and conventional medicine. And so if you're curious to learn more about that, the first couple episodes I talk a lot about what the difference is and what that looks like. And there's one on the blood type diet too. So if you're interested in learning more about eating right for your blood type, it's a good listen.
Okay. Well, thank you so much, Dr. Kinney, for being
You're welcome.
Amazing session.
Thank you for having me.
Yes, a lot of information to all the viewers. You know, let us know. We are here every single day, either on Insta or on FB Live, trying to educate you, you know, and to empower you that naturopathic medicine, natural medicine can actually help to recover whatever you're trying to recover, hormone balance or what have you. With that, thank you so much. Bye-bye.
You're welcome. Have a good one, everybody. Thanks for listening. All right, bye.